I gave you my heart.
Hello guys, you must be thinking that what I'm trying to do here. So before anything, let's get changed and then come back to the topic. So today's topic for the discussion is presbyopia. It is a common condition associated with aging of the eye which results in progressively worsening ability to focus on the closer objects. It occurs due to hardening of the lens of the eye, causing the eye to focus light behind rather than on retina when reading closer objects. It is a refractive error along with nearsightedness, farsightedness, and astigmatism. People over 40 are at risk of developing presbyopia and all are affected to some degree. Around 25% of people are currently affected by presbyopia. The condition was mentioned as early as in the writings of Aristotle in the 4th century BC. Most of the people notice difficulty in reading fine prints during low light conditions, eye strain when reading for longer period of time, blurring of vision and blurring of near objects. Many extreme presbyopes complain that their arms have become too short to hold the reading material at a comfortable distance. The onset of presbyopia varies among those with certain professions and those with myotic pupils, in particular farmers and homemakers, whereas service workers and construction workers seek correction earlier. Scuba divers with interest in underwater photography may notice presbyopic condition while diving before they recognize the symptoms in their normal routine due to the near focus in low light conditions. Many people with nearsightedness can read comfortably even without glasses or contact lens even after the age of 40. However, their myopia doesn't disappear and long distance visual challenges remain. Myopes considering refractive surgery are advised that surgically correcting their myopia after the age of 40 may be a disadvantage to them. When the eyes become presbyopic and lose their ability to accommodate or change the focus, they will then need to use glasses for reading. A surgical technique is to offer a reading eye and a distance vision eye, a technique commonly used in contact lens practice, known as monovision. Monovision can be created with the help of contact lens. So the candidates for this procedure can determine if they are prepared to have their cornea reshaped by surgery to cause this effect permanently. So the treatment for this condition are in many ways. In the visual system, images captured by the eye are translated into electric signals that are transmitted to the brain when they are interpreted. As such, in order to overcome presbyopia, two main components of the visual system can be addressed: the optical system of the eye and the visual processing of the brain. The first one is image capturing of the eye. Solutions for presbyopia have significantly advanced in recent years, thanks to widened availability of optometric care as well as the counter vision correction. Second, image processing in the brain. Scientific solutions for overcoming the symptoms of presbyopia were developed in recent years and tested successfully. These solutions are available thanks to significant progress in the understanding of human brain, plasticity, and the field of perceptual learning. The next way for treating presbyopia is corrective lenses. Corrective lenses provide a range of vision correction, some as high as +4 diopter. People with presbyopia choose convex lens or reading glasses. Specialized preparations for convex lens usually require the service of an optometrist. Contact lens can be used to correct the focusing loss that comes along with presbyopia. Multifocal contact lenses can be used to correct vision for both near and the far. Some people choose contact lens to correct one eye for near and one eye for far with a method called monovision. The next way of treating presbyopia is surgery. Laser surgery has been done to create multifocal cornea. Concerns with the surgery include people's eye changing with time.